Okay, good afternoon, everybody. I think we're ready now, and I'll call to order our meeting of the Health, Environment, and Community Engagement Committee. Before I go through the agenda, I just wanted to congratulate the Health Department and announce to everybody that the Minneapolis Health Department has been awarded the national accreditation for the next 5 years by the Public Health Accreditation Board. This is a pretty big deal. We had to go through a rigorous multi-faceted peer-reviewed assessment to ensure that our health department met or exceeded specific set of quality standards and measures. It was a big decision to even get into this because of all the staff time and the involvement and the community involvement and all the evaluation. And so it's fantastic news that we are now fully accredited nationally. This means we join about 135 other accredited health departments from among the nation's nearly 3,000 governmental public health departments. In the state of Minnesota, this includes the Department of Health, Hennepin County, and Washington County. This also gave us an opportunity to assess our own strengths and needs for improvement. So it was really good to kind of get this outside look in on our department to feel like we were doing what we could to improve and also acknowledging where we were successful. And this also promotes consistency in the nation about what is a health department and what is an accredited health department. So great news. Congratulations, everybody who worked on that. And, I think we're good now for a few years. So we have 7 items on our agenda today. We have 4 consent items, and we have 3 presentations. So that actually we have 5 consent items. Sorry, that adds up to 8 items. I'm going to go through the consent agenda first, and if any committee members want to pull something off for discussion, we can do that, and then we'll take up our discussion items. The first is approving appointments to the Minneapolis Advisory Committee on Aging. There's 2 appointments before us today. One is Mary Tracy from Ward 1, and the other is Richard Kavanagh from Ward 3. Second item is accepting a grant from Hennepin County in the amount of $24,000 to provide contraception to under and uninsured teens through the school-based clinic program. Third item is accepting a grant from the Federal Center for Disease Control and Prevention in the amount of $1,700,000 over 5 years to prevent teen dating violence and youth violence. And the fourth item is authorizing amendments to community wellness contracts to reduce hypertension and diabetes, just to extend all the termination dates to the end of the federally approved grant period. And the dates are listed on your agenda if you want to see those, and the 3 different grants. And the fifth item is referring to staff's subject matter of an ordinance amending Title 10, Chapter 188. This is relating to selling and sorting on streets. And I think that's nearly done, but we're not quite ready to set the public hearing date yet. So on those 5 items, seeing no discussion, I will move all 5 of those items for approval. All those in favor, please say aye.
Aye.
Any opposed, say no. Those all carry. And now we move on to our discussion item. There's 3 of these. The first has to do with the Joint Powers Agreement and Memorandum of Understanding for our Youth Curfew Truancy Services Center. And we're going to have a presentation. And I believe that Mr. Josh Peterson is going to lead our presentation on this. This is a significant grant, and we did some evaluation and looking at what kind of services we're getting. I should say a significant contract. So welcome.
Thank you, Mr. Chair and council members. So as Mr. Chair said, I am Josh Peterson. I'm a senior public health specialist with the Health Department. I'm here today on behalf of both the Health Department and the Juvenile Supervision Center work group. And as the agenda said, I'm here for sort of 2 purposes. One is execution of a new joint powers agreement related to the Juvenile Supervision Center, and the other is execution of an MOU related to the JSC. And I'll get into the details of those in a little bit. But first, I thought it'd be valuable to just give a little bit of overview about the JSC, both because we're talking about a long-term commitment to it, and also because we don't often have the opportunity to come up here and tell you about the great work that's happening there. So I'm going to give a little bit of an overview of the JSC. It's located right here in City Hall downstairs, and it's meant to be a youth-friendly early intervention resource for young people ages 10 to 17 who encounter law enforcement for curfew, truancy, or low-level offenses. It does align with the city's Blueprint for Action to Prevent Youth Violence, which is the city's comprehensive youth violence prevention plan. Specifically goal 3, which is intervene with youth at the first sign of risk. So this is really sort of the city's kind of hallmark program to intervene with young people at the first sign of risk. So it's really an important part of the city's strategic plan around that. It is open 24/7, 365, and it's staffed currently by The Link, which is a youth-serving nonprofit. I won't go into all this history. You can read a little bit about it, but the key point is that the JSC was started back in 1996. That's when the original Joint Powers Agreement was signed. It was a 20-year term, which is why I'm back here again 20 years later, seeking approval of a new Joint Powers Agreement. And then the other piece is back in 2008, there was sort of a shift within the JSC, and we added some aftercare services and 24/7 operation of the center. A little bit about the oversight. So both financial and just sort of general governance oversight of the JSC is shared equally between the city, Hennepin County, and Minneapolis Public Schools, which are the 3 parties that make up that Joint Powers Agreement. There is a Joint Powers Board, which the city is represented on by the mayor and the city coordinator, and then there are sort of similarly positioned folks from the county and public schools on that board as well. And then there's a JSC work group, which meets monthly, and we do sort of ongoing service delivery troubleshooting and things like that. And I'm joined here today by some folks from the county and Minneapolis Public Schools from that work group, so if there are questions later that would involve them, they can certainly speak to those. So a little bit about sort of what happens at the JSC. If a young person encounters law enforcement for, again, curfew, truancy, or a low-level offense, the law enforcement officer decides to bring the young person here to the JSC. The officer is here for 5 minutes or less, and that was intentional so that it's not sort of burdensome for law enforcement to access it as a resource. We want law enforcement to feel like they can use it as a resource for young people, so we try and get them in and out quickly. The young person comes in, and first of all, it's a safe and supervised space. So if the young person doesn't have a safe place to go to, if there's maybe nobody at home, or if there is no home to go to, they can come here and be safe and supervised until there's some place they can get to. They meet with a staff who's a trained youth worker who does risk and needs screening as well as a separate mental health screening to really get at sort of what are some of the barriers that the young person might be facing, what are some of the needs that need to be addressed. Then the staff works to reconnect the young person to their family. That can be as simple as making a phone call to the family and explaining the situation. The parent guardian comes and picks the young person up. But it might be that transportation is a barrier, in which case the JSC is staffed to transport young people home, or we also have some MPD officers who are available to transport young people home as well. And we also know it's not always that simple, and perhaps there was something that led to the young person leaving in the first place involving that parent-child relationship. So in that case, the staff will do some sort of informal mediation between the parent and the young person. And then also there's just some immediate resources and referrals. So if the young person comes in and has a need that's, relatively simple, they'll provide some, a phone number and a resource or a referral. But if that needs risk assessment triggers sort of broader needs or more long-term needs, there's also an aftercare component. So they offer community-based aftercare, which has sort of 2 tracks, case stabilization and case management. Case stabilization is primarily for young people who have sort of very immediate needs around housing, chemical dependency, mental health, things like that. Case management is longer term, so up to 6 months. In either case, case managers are meeting with the young people on a weekly basis, working on addressing needs from getting enrolled in school, keeping up with school, finding a job, accessing mental health services, food stability, housing, connecting to a music program or an art program, sort of all those kind of comprehensive holistic services that these young people might need. So again, it's a really great opportunity to have a conversation with a young person, assess what the needs might be, and then provide both short-term and long-term services to work toward those needs.
So how many case managers are there?
Mr. Chair, that's an excellent question. There are 3 case managers.
And are we going to get some more information about the caseload?
Yes. So up on this next slide, thank you, Mr. Chair.
And I've just got one other question then.
Yes.
And it's totally voluntary if one of the youth want to take advantage of these aftercare programs?
Thank you, Mr. Chair. Yes, it is completely voluntary. So the center services themselves are voluntary. So it's hands-off. The staff are never putting hands on young people. If young people want to leave the center, they're able to leave. And then for the case management services, they're entirely voluntary.
Thank you.
You're welcome. So the next slide to that question has some stats about the youth served. This is for year 2015. As you can see, about 1,200 young people were served, and that's over the course of about 1,800 visits. So a number of those young people did come through multiple times. And of those, about 600 were served by aftercare. So almost half the young people coming through were served by aftercare. The average age there is 15 and a half years. And something that's not on the slide is roughly 50% of the young people coming through are seen for low-level offenses. About another 35% or so are curfew, and then truancy is the lowest, and that's at about, I think, 13%, something like that. Something that is sort of, again, speaks to the need to intervene at this point is these sort of barriers or issues that youth present with the JSC. You can read through the list, but I want to highlight a couple of these. The first is that 76 young people who came through left the JSC immediately to shelter. So that means those young people came in without some place to go afterwards. And had it not been for the JSC, they might have ended up on the street, couch hopping, something like that. So it really speaks to sort of that immediate need that we can provide for those young people, that if it weren't for the JSC, who knows where they would be. Similarly, 230 screened for appropriate mental health services. Again, those are young people who may have unaddressed mental health needs, and were it not for something like the JSC, those needs may remain unaddressed. And then finally, not enrolled in school. While that number seems relatively low, I think it's very significant because school is often the opportunity to really intervene for people of this age. And so if you've got young people who are disengaged and not in school at all, there really is sort of nothing where we can sort of catch them and do that risk needs assessment and really offer those services. So the JSC operates as sort of a nice safety net for those young people who aren't enrolled in school to get them back enrolled in school. Here's some youth served numbers around geography. So on the left side there, we've got the Minneapolis residents who visited the JSC mapped out by home address. On the right side, we've got the law enforcement agencies who encountered the young people. So that's basically, 19% were picked up within Precinct 1, 10% within Precinct 2. And then key also to note is over the past 5 years, over 70% of the JSC visitors have been Minneapolis residents. So though this is shared between the city and the county and is jointly funded, a significant portion of the young people are coming from Minneapolis, and it really speaks to sort of why the city needs to stay committed to this effort. Here's a slide with some race information. A couple of notes about this. The first is that these categories are based on the CDBG race categories. So the city's funding comes from Community Development Block Grant, and so when we report to them, we're required to report based on these breakdowns. The second piece is this information comes from the referring law enforcement officer. So there are times where they may say unknown and they may say multiracial. In that case, the staff will follow up and ask for more detail. But we know that that results in data that's maybe not as accurate as it could be. So we're actually currently working on a process where youth can self-report race, because I think that that's going to make it much more accurate.
So this 74% Black African American is kind of concerning. I think I'm not really sure what the demographics are for juvenile, but I'm sure that in the citywide it's a much lower number than 74% of our general population. And I know that in the past there have been some data and some reports, I think maybe in the media, about, I don't know. I'm concerned about disparate treatment. And are we seeing kids that get picked up and driven home and don't ever make it down to the center? And are we tracking any differences there? How alarmed should I be for this? Just to put it in perspective, everybody's heard about the kind of the pipeline to prison and low-level offenses and getting kids young involved in the criminal justice system often puts them on track to getting more involved. And I know our whole intention of getting the link involved in all of this was to try to break that and get services. But can you help me know how concerned I can be and what we should do about that high percentage of Black and African Americans who seem to be getting singled out to be taken to our juvenile curfew center?
Sure, Mr. Chair. Thank you. That's a great question, and I will do my best. So yes, I think that is a really important question. It is a great question. I think that those numbers do stand out. I'll say a couple things about it. The first is that the JSC exists as a resource to serve young people who are brought to the JSC. So to some extent, that's a law enforcement policy question. It's an MPD policy question, but also any of the law enforcement agencies that are referring young people. Really, the JSC is set up to serve anyone who comes through the doors and to serve those young people equitably and with quality service. So to some extent, it's outside the realm of control of the JSC to determine who comes in. I would say, though, to your question about making sure that all young people are served, we have had conversations about how can we make sure that young people who don't make it to the JSC and who are brought home receive services. And so as part of the work group and some work with Hennepin County, we've developed a curfew diversion pilot where young people who receive curfew citations and who aren't brought to the JSC do receive contact from the JSC staff and are offered similar services. So again, from the JSC side, we're invested in doing whatever we can to make sure that all young people who are appropriate receive these services. But to your question about sort of the disparate, potential disparate treatment, I mean, I think it is an important question because we know that if we want to impact disparate outcomes and inequitable outcomes in the criminal justice system, we need to start early. But I guess I will go back to my point that really is something that I would defer to MPD on and to other law enforcement agencies because they're the ones making the determinations about whether young people are brought to the Juvenile Supervision Center or brought home. I would say that our work group is interested in providing sort of insight and support around that, and we will advocate around that. But ultimately, we just serve the young people who are brought through those doors.
And so maybe that's something the council can try to pay more attention to, too. I'm curious about if there's a kind of a paper trail when they're brought in. Most of them end up getting a citation and some kind of arrest record just for getting brought in, or not?
Thank you, Mr. Chair. Yes, so if they're cited, there is a paper citation. And that citation within MPD stays a paper citation. Within some of the other law enforcement agencies is routed as an e-citation, which goes to the Hennepin County Attorney's Office. And
so does everybody get a citation, and is that how we're able to take away their liberties for a little while and bring them in? Or do some people come in because they want to and there's no citation involved, or it's just part of an investigation? Or should we assume that those percentages are then going to leave with a ding on their arrest record, which if they're a juvenile won't be made public at least?
Thank you, Mr. Chair, for that question. So a small percentage of young people who come in do come in with no citation, and that may be coming in with law enforcement but with no citation. So either law enforcement chooses not to cite but wants to bring them anyway, or if there's potentially a situation where a young person needs some services and law enforcement is there, staff from, say, a park can make a connection and say, can law enforcement, can you help bring this young person to the JSC to get some services? There are occasionally young people who will show up on their own to try and get services. Usually that's clients who've been there before, who know that it's a safe place to go on a Saturday night. It's a warm place in the winter. It's a relatively small percentage. The vast majority of young people who come through are coming through with citations.
And is there, how closely is the center connected to restorative justice options?
Thank you, Mr. Chair. So I would say a number of the young people who come through are on, say, Hennepin County probation for other offenses or have committed other offenses. Particularly if they're on case management, those case managers will work with restorative justice providers if that's appropriate to help facilitate that. They will also work with diversion providers, both to sort of help facilitate the diversion resource, but then also to serve as an advocate for the young person, say in court, to say this young person is on our case management database, or case management caseload, they are complying, which often will help in the eyes of the judge around what the young person's up to.
Okay. And I don't really know if we have any years looking back or looking forward or what we should do, but looking at this one and then the number of people from the 4th precinct that got picked up, is like, well, are we over-policing or are we exacerbating disparities? And something I think that we hopefully can all be aware of and figure out how to track.
Yeah, thank you. I think that's a great point. And I would say from the JSC side, we will make available any and all data we can to help with that. I think what we would need to do is match that to law enforcement data because they're the ones tracking whether a young person is brought home versus brought to the JSC. And we would be happy to contribute to that.
Well, and that's important data to compare. Yeah. Thank you. And I'll let you continue. I'll try to be a little quieter.
No problem. Thank you, Mr. Chair. So speaking of outcomes, this is one of sort of the hallmark outcomes we point to, which is a very simple one, but I think a pretty evocative one, which is that pretty much every year, 75% of the young people who come through only come through one time. And obviously, we can't attribute fully a young person not returning to the JSC services, but I think we can certainly point to it as something happening at that JSC interaction that changes the trajectory of that young person. And since we know that, only about 25% of the young people actually come back, we can't really track things longitudinally for a large portion of the young people who come through. So what we focus on is outcomes about what actually happens at the center where we can control it. So here's a few examples of that. Essentially, we're meeting or exceeding all of our targets around whether young people are safe, kept safe, and whether they feel safe at the JSC. We do have the ability to track young people over time for those who are in the case management program because those relationships are longer term. So here we have a few examples of some of those outcomes. As you can see, they're pretty high, and they also exceed our goals. And over the past 3 years, they have around whether or not young people re-enter the JSC, whether they're decreasing high-risk behavior. Particularly important is, again, getting young people back enrolled in school and also improving school attendance, because if we know that they're connected to school, they're less likely to be engaged in some of these behaviors. So switching gears a little bit to explain a bit about the budget. So the total operating budget of the center is about $760,000. That's actually split into two contracts. One is for about $295,000. And that contract then is split 3 ways equally between the city, the county, and Minneapolis Public Schools. And that funds the curfew and truancy portion. There's an additional contract for about $465,000, which is funded solely by the county. And that covers 24/7 operation and all of the aftercare services. So the reason why I'm here today, the reason why I gave you all of that context is that, as I mentioned, the previous Joint Powers Agreement was signed in 1996, and it expires at the end of this calendar year. So we've drafted a new Joint Powers Agreement, which would take effect January 1 of 2017. It was drafted by a subcommittee of the work group. It was subsequently approved by our Joint Powers Board and has also been approved by the City Attorney's Office, the County Attorney's Office, and the Office of the General Counsel of Minneapolis Public Schools. So one thing we did was just sort of update the language to make it actually reflect what's happening now. But there's a few other key changes, which you can read here. I'll just highlight 2 of them. One is that under the old agreement, the city held one of the contracts with the contractor and the county held the other. For ease for both the contractor and the entities, we've updated it in the new one so that there's just one fiscal agent, and that would be the county. And the other piece is that the old agreement was 20 years, as I've said. The new agreement would have a term of 10 years, and that's just based on some feedback we've gotten from the board members in the work group. There is potential future budget implications for this. So as I mentioned, the city has used CDBG funds for its equal share of $100,000. There could be budget implications sort of in 2 ways. One is if CDBG funds become unavailable, the city would need to find alternative sources of revenue to fund their equal share. The other is that currently the city shares $100,000, which is how much is allocated in the CDBG budget. So if the annual share of the budget for the JSC were to increase above $100,000, the city would need to find some way to offset that difference between what's available with CDBG funds and what the annual budget is for the center. The other piece we're here about is a memorandum of understanding. So the idea behind this is to officially capture all the sort of additional non-financial resources or in-kind resources that the 3 entities are already putting forth and have been putting forth for the past few years, which are essential to the operation of the JSC. So, for example, the county puts forth the additional $465,000 for aftercare and a transport van. Minneapolis Public Schools puts forth computers, IT support. So the city puts forth a host of things right now, and again, has been for years, including the physical space in City Hall, sort of all the associated costs with that, so utilities, copier, landline. As I mentioned, the city puts forth transport officers from MPD, as well as MPD squad car use, and then a few smaller things like mail service. And so the hope is that the city would agree through this MOU to continue to do that because, again, these things are essential to the operation of the JSC. And the idea behind the MOU is that should any entity want to pull out one of these things because it's essential, it would be great for the work group and the board to have some notice so they can work up some contingencies for those things. So that's the background and that's sort of the ask. I'm happy to entertain any other questions or if there are questions from folks from the work group, or we also have some folks from the link here as well who can answer any questions specifically about what they're doing on site. And I would also be happy to offer a guided tour of the JSC at any point. So if any of you are interested in that, please follow up with me as well.
It might be interesting to get a tour, so maybe we can follow up on that. I don't see any other questions up here. I have one question about the relationship this has had, or if there's any better connections that we could build between the Youth Violence Prevention Executive Committee and what's going on in the center. I know they were instrumental in kind of trying to improve it and expand the hours and the coverage and even recreating the juvenile division in the police department years ago. And this might be information that would be good if they heard too, and they also might help us grapple a little bit with, are there disparities going on in here and what can we do about them? Do we have they had an opportunity to weigh in on any of these changes? Or are there any plans to bring this back to them sometime?
Thanks, Mr. Chair. I think that's a great idea to bring it back. There are sort of connections in the sense that I chair the JSC work group, and I also staff the Youth Violence Prevention Executive Committee, and sort of similar connections. But we have not made a formal report like this to the YVP Executive Committee, and I think that would be a good idea because the conversations the YVP Executive Committee have had around disparities, disparate treatment are the same ones that the work group is having here. So I think that having more minds thinking about it is a great idea.
Good. They might also know what we could look for greater success or not. It does look like we've had a lot of success. I noticed that there wasn't really a tracking of those cases that got chemical dependency treatment or those kinds of things, although there was a general category probably that included those in that one page. But and I'm assuming the PowerPoint will be available online for everybody to see after this meeting as usual. So I think other people might be interested too. I don't see any other questions. Does anybody else want to say anything before we make a vote on this? Thank you very much for your involvement and your service in this area. Okay, then I'm happy to move this item. I think what we've got to do is two actions. One is authorizing execution of the Joint Powers Agreement, and the other is authorizing execution of the Memorandum of Understanding. Any questions or comments on those motions? Seeing none, then all those in favor, please say aye.
Aye.
Any opposed, say no. Those motions carry. And now we have a presentation coming up, and this is the only action on this is to receive and file, but it's an interesting presentation on a Focus on Fathers research project. And welcome. I'll let you two introduce yourselves and take it away when you're ready.
Thank you very much, Chair Gordon, committee members. My name is Megan Keynes. I'm a senior public health researcher and epidemiologist with the Health Department.
Thank you, Chair Gordon, committee members. My name is Paul Redman, and I'm a research assistant at the Health Department.
We've been working intentionally on men's health efforts for a while now at the Health Department, and from this work has flowed a focus on fatherhood and health. In the context of the health of the city, we know the health impact of father involvement on families in general, and we know that during pregnancy and just after birth, father involvement is good for moms, good for babies, and good for dad's health. We've been doing a larger project on supporting fathers, unmarried fathers specifically, and as that project progressed, we learned that there were significant barriers to that actual concept of father involvement. They begin at birth. They undermined unmarried fathers' desires to be involved with their children. And key, we learned that unmarried fathers are looking for support. Since 1940, births in the U.S. to unmarried mothers have increased tenfold, and Minneapolis is more or less in line with this trend. In 2014, there were 40% of births were to unmarried mothers. As our larger focus on fathers